Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, it's the Public Health on Call Book Club. Our topic is dinner and whether it can save the planet. I'm speaking to Jess Fanzo, a Bloomberg Distinguished Professor at Johns Hopkins and an expert in food systems, about her new book. What's that, you ask? Did this discussion give me a lot of food for thought? It certainly did, and I think it will give you a lot of food for thought too. Let's listen. Jess Fanzo, thank you so much for coming to Public Health on Call. I'm really excited to talk to you about your new book, Can Fixing Dinner Fix the Planet? So I want to first ask you to talk about one of the challenges today with our food system in the world.
Yeah, thanks for having me, Josh. I think one of the biggest challenges that we face with food systems is that the diets that are being produced by food systems are not healthy. So when this podcast is all about public health, and one of the biggest concerns we have is that diets are now one of the top risk factors of morbidity and mortality. These diets are suboptimal, and they're not healthy for individuals, but you really see the inequities that some populations face in being able to access what's considered a healthy diet. So that's one of the greatest challenges that we have right now with food systems. Is food systems largely are just producing these suboptimal diets that most of the world is consuming.
And the results of that for health, I guess, heart disease, diabetes, but what else do you see?
It ranges. We have multiple burdens of malnutrition. So there's some populations that don't get adequate diets. They're not nutrient rich. So you're seeing issues of stunting, chronic undernutrition, micronutrient deficiencies. And then, as you had said, obesity and non-communicable diseases like cardiovascular disease, stroke, diabetes, that diets are so central to as a risk factor. So they're big issues.
One of the interesting points in your book is that sometimes these different health challenges can coexist, that you see both undernutrition and obesity, both heart disease and stunting. How does that happen?
Yeah, when children are growing up, if they don't get the right nutrition, they can be at risk for being stunted. And then if they put on weight because they get a bolus of food, they can put on a lot of weight but still be stunted. So you can have a child who is both stunted and overweight. You can have a child who is stunted, has micronutrient deficiencies, and is overweight. And this is this new phenomena of seeing these comorbidities that present significant risk factors into adult life.
Now, you just used the word new. So one question is our diet really getting worse? And what, if that's the case, is driving that compared to, say, 20, 30, 40 years ago?
It's a mixed story because diets, in one sense, are more diverse. We have access to a significant range of different kinds of foods. We're not just dependent on seasonality, what is grown during certain seasons. We can get food from all over the world. It's more about who can get access to that food. So that's one issue, is that we've got this diversity of food, but not everyone can get access to it because they live in places where food supply chains don't work or the food is just unaffordable. The other issue we have is that with that diversity comes a range of foods, or what is called ultra-processed foods. These are processed packaged foods that are very high in sugar, salts, and unhealthy fats. These foods are the cheapest foods in the world. They're moving all over the world. They're really cheap and they're tasty. And these are incredibly detrimental to health. There's been a lot of studies coming out in the last 2 years of the impact of these ultra-processed foods on body weight and again on risk factors related to non-communicable diseases like cardiovascular disease and diabetes. So the ultra-processed foods that you see all over the world, potato chips, cookies, all that good stuff is making up a large percentage of the diet just because people are on the move. They have busy jobs. They don't have time to cook. And these foods are just super convenient.
The other point that you made, which I thought was very interesting, was that even as, a supermarket might have a whole bunch of things for consumers to buy from around the world, the actual biodiversity, the types of plants, for example, that we're eating around the world is shrinking. Could you talk about that a little bit and the potential consequences?
Yeah, so the biodiversity of plant species, animal species is important, not only for our diets, but for Earth systems, having that rich biodiverse forests and landscapes. And obviously climate change and human-induced climate change, our movement, our urbanization, our extensification into biodiverse landscapes to grow food is declining to the point of many species being threatened. Biodiversity for agriculture and the foods we grow is also declining. Our agriculture systems are becoming very homogenized. 75% of all the foods we grow center around 10 to 12 crops and about 5 animal species, which is incredible because that puts us at significant risk if there were to be a climate shock or a food shock to some of these crops that are feeding a lot of people. So it puts us at incredible risk for food insecurity and also decreasing the risk of us being able to get a diverse diet. So it's a real problem to not have a biodiverse food system.
So too much access to foods that are unhealthy, too little access to foods that are healthier, shrinking biodiversity. What is a planet to do?
Yeah, well, one of the big things we need to do is deal with climate change. We have to mitigate and adapt to climate change. Climate change is probably the most significant risk to our functioning food system and the kinds of diets we consume. So there's a lot of different ways to tackle climate change, ensure that farmers and producers can adapt to climate change, and consumers can make big shifts in the kinds of foods that they decide to eat because our diets are also impacting climate. So we need to be thinking about climate policies and how those influence food policies.
Now I'm going to ask you about a controversial topic that relates to this, which are genetically modified foods. Because part of the case for genetically modified foods is actually that they can have less of a climate impact, that they can produce more food with less space, with less water, with less, other resources and energy. Is part of the answer these products?
It could be if used in a responsible way. In places like in sub-Saharan Africa and other drought-prone areas, these GMOs can be very important in ensuring that populations are food secure. Where it can become controversial is what's used with those GMOs, what kind of pesticides, herbicides, and other inputs, fertilizers, how those are used and the dependence of those when applying GMOs. And that's the controversy from a health perspective. It's not so much that the GMO and the ingestion of the GMO itself is damaging. There's no evidence to suggest that. It's the inputs that are associated with the GMOs that a lot of farm workers are exposed to. So that's one controversy from the public health perspective is the inputs required to grow these GMOs. There's a lot of other issues around ownership of these seeds and things like that are a whole other kind of conversation. But from a public health perspective, it's the inputs necessary to grow these GMOs and the exposure of farm workers to those inputs is the most challenging issue right now with GMOs.
Very good. Thank you for walking through that. Another idea in your book is to reduce food waste through a better supply storage system and supply chain as a way to reduce the need to use very energy intensive, food production methods. How would that work?
So about 30% of all the food we produce on the planet is thrown out or lost. There's a lot of different technologies and tools that farmers can use to ensure that they don't lose their crops to pests and herbicide or pests and insects and other rodents that are eating away their crops. A lot of tools to better store crops to avoid toxins getting into those crops and subsequently losing those crops. Where we see a lot of waste, though, is at the retail and consumer level. So there's the food loss that's along the supply chain, but then there's the food waste. Food that's made it to markets, it's made it to your kitchen, it's made it to your refrigerator, and you just don't use it. And so a lot of the food is wasted. And there's so many things you can do as an individual, right? Not buy so much food like you're storing up for a, nuclear holocaust. Thinking about reaching to the back of your refrigerator instead of stocking it so much that you can't see the back, using your freezer. So there's lots of ways to reduce your waste every day. Being innovative about making soups, throwing everything in the pot kind of thing. So that is the biggest issue, particularly in the United States, is around food waste.
So you have a set of recommendations, some of which are very big policy recommendations, like around genetically modified foods, as well as, the food supply chain, but also you go all the way up to, things that affect consumers and literally what they're deciding to make for dinner. I'm going to ask you real quick about a couple of these. When you say, let's improve the choice architecture for purchasing, can you explain what a choice architecture is?
So every day you walk into a supermarket or a restaurant and you make a choice. And we call those the food environments. Those are the places where you are walking in, Josh. You bring with yourself all of your own traits and your desires and how much you want to spend on food. But those food environments, the way they're designed, are pushing you to make certain decisions. Think about all the candy bars next to the cash register when you're standing in line at Trader Joe's. How can we change that architecture so it's easier for consumers to make healthy choices? So it's all about the design of these food environments. They are nudging you to make certain decisions, right?
So is there a way to stop the rice pudding from calling to me from across the grocery store?
Depends on how far you have to walk. But the way supermarkets are set up, and Marion Nessel from NYU always talks about, she says, walk the whole perimeter of your grocery store, because everything in the middle that you don't have to walk far to is all the highly processed foods. But you got to walk the perimeter to get to the fresh, healthy stuff. It shouldn't be that way, right? All that food should be right in the center. When you walk into McDonald's and you get a Happy Meal, why is the default side French fries? Why isn't it a salad? And you'd have to ask for the French fries if you wanted to replace it. Instead, we always have to ask for the salad as the side, right? Do we ever ask for the salad as a side? I don't know. But this is kind of this choice architecture, right? Things are designed or assumed to be a certain way. And by changing that architecture, you're just nudging people in different directions. You're not forcing them to make specific decisions like regulating, which you know well, but it's more about changing the design so people are navigating a store in a very different way.
Got it. You also are in favor of ending what some people call food deserts, making sure that there's healthy food access to everyone. Are there particular ways to do that in a country like the United States?
So food deserts are really problematic because you often see them in places where there's poor populations living or disadvantaged or marginalized populations. We see in Baltimore the redlining issues where places that have been less invested in because they're predominantly African-American neighborhoods. So how do we improve that? Well, one is systemic changes around urban policies, which you know well, Josh. So we need to change those more systemic issues around who gets prioritized in systems. But from a food specific lens, there's lots of ways to ensure that we minimize food deserts, or what we also call food swamps, which is it's just junk food all around, right? There's nothing healthy. And that's incentivizing retailers to come in by giving them tax breaks, giving them subsidies, encouraging more community-led gardens, community-led initiatives, community-led food banks. We see a lot of that in Baltimore. More interesting innovation around food trucks and food delivery services at low cost. We've seen that in Native American neighborhoods. So there's a lot of different ways, from very community-driven to much more government incentive-driven to minimize food deserts.
Thank you. Last question has to do with your thoughts on the nutrition label and how we can learn more about foods to the nutrition label that can help us fix a healthier dinner.
Well, the back of the package label is not so useful, and a lot of people don't even look at it, and a lot of people don't really understand it. There's been a lot of work on the front of the pack. If you look at the front of packages now, it's totally anyone's guess, right? It's free game to put whatever you want on there. You can put gluten-free on something that is never meant to have gluten in it. So industry really kind of plays with that front of the pack. There have been some lessons from other countries where they have put in stop signs or stars to indicate whether or not a food is healthy or unhealthy. Chile, the country, is one example where they put black stop signs on the front of packages to say if it's high in sugar, it gets a black stop sign. If it's salt, it gets another one. If it's unhealthy, very high in fat, it gets another one. And that's been really useful in alarming consumers to whether or not they want to purchase that based on those stop signs. Chile took it one step further, and they actually regulate that food. If the food has stop signs on it, they can't sell it in or near school. You can't advertise it on TV during the hours when children watch TV. So they've regulated it. The other kind of side effect of that is that industry, to not get that black stop sign, they reformulated their foods. So it also spurred industry to try to get their foods a bit healthier to avoid having that stop sign. So this had multiple effects: consumer education, regulating that food, and then reformulating that food. And everyone is looking at that Chile example as a good example, because consumer purchases of those foods that had black stop signs decreased about 30%. So it's a really interesting live experiment happening in a country.
Absolutely interesting. Thank you for sharing that and for talking about your new book. But I would get in trouble if I didn't ask you what you recently had for dinner before we finish. Anything you want to mention?
Well, I'm in Bologna at the moment, which is kind of considered the food capital of Italy. It's very meat heavy, so it's not a climate friendly diet. They eat a lot of tagliatelle with ragu, like meat sauce and mortadella and all these kind of things. But last night I had pesto pasta with a little bit of mozzarella di bufala on the side and a big arugula salad. That was my dinner last night. And some wine, of course, because I'm in Italy. A Sangiovese. What did you have, Josh? What did you have for dinner?
Unfortunately, we're out of time with the podcast. Actually, we just had a big salad last night. So you caught me on a good day.
Good.
Thank you so much for joining. And again, your book is Can Fixing Dinner Fix the Planet?
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.